and we're talking to my good friend, Dr. Betsy McCaughey. We're talking about C. diff, and also I'm sorry that we're not getting to a lot of question and answers. A lot of people are calling in. If for some reason I don't get to you before the show ends, call 212-365-5000, 212-365-5000, and we'll have you on the show in the future. What is the site that you want to talk about the C. diff?
Yes, if you have questions about C. diff, come to our website, hospitalinfection.org. Our mission is to help you protect yourself in the hospital. So the website is www.hospitalinfection.org.
And we'll also put your piece on samadimd.com. Okay, here we go. Obamacare. Okay, we're seeing some of the issues that's coming. And again, as a physician, I'm not going to tell you whether I'm pro-Obamacare or I'm against it. I'm just reporting this. But I can tell you that as of a year ago, even as a doctor, I can see a lot of confusion on our ground floor. Patients are coming in, deductibles are a problem. They don't know whether they're covered or not. A lot of these patients who have had Medicaid are now being converted to Obamacare. The reimbursements for Medicare are going down, and people are seeing that Medicare and Medicaid are coming closer. Overall, it seems like a mess, and my staff are always complaining.
You're so right, but let's update everyone on what's happening, because in the news, everyone's heard about the Supreme Court case. This is the second time Obamacare is in the Supreme Court. The court is going to rule in late June. The case is called King versus Burwell. And this time the issue is, has the Obama administration ignored the actual text of the law and provided taxpayer-funded subsidies to Obamacare purchasers in all 50 states when the law says it can only be in the few states that set up their own exchanges, like New York State, by the way.
And what happens if the Supreme Court says, Obamacare is out, and people would say, there's a big vacuum, they're not going to have insurance?
That's the question. And of course, there have been lots of predictions of absolute disaster, but don't be bamboozled by that, because the fact is there isn't going to be a sudden disaster for two reasons. One is that the court is already considering, if they do rule against the Obama administration, that they will postpone the impact of the ruling until next year. And secondly, the Republicans in Congress have already put together what they call the exit ramp plan, which will be introduced in Congress and be all set to go into effect when the Supreme Court rules. And that will provide substitute subsidies for people who need help buying health insurance. And it will allow people in those 37 states that are affected to choose whatever kind of insurance they want. It won't have to be the one-size-fits-all plan. They will be able to buy it any day of the year they want. It won't have to be during the Obamacare open enrollment plan. There'll be no more penalties for people who don't have insurance, and there'll be no more employer penalty. So that will relieve the pressure on employers to keep their workforce below 50, to keep their workers' hours below 30. You should see a big boost in job opportunities if that occurs.
So you think that it's going to be a smooth transition? There's not going to be a big chaos based on what you heard from the Republicans?
Well, and this is unusual, but Congress is actually behaving responsibly and getting ready for this decision.
So who pays for this? This whole process of transition. So we're going to get them
Actually, it will provide tremendous relief over the next 10 years, about $750 billion in relief, because the Obamacare entitlements are so costly that transitioning to another system will save money, and that will mean more money for the things.
How about the corporations that are obligated right now to buy this Obamacare for their staff and their workers? Are they off the hook now? They have the freedom to say, look, we will support it, but you have a choice.
Remember that almost everyone in America, 165 million people, already had employer-provided health insurance before this law went into effect. That's how most people get their health insurance. And in fact, since Obamacare has gone into effect, because of the rigidity of the rules, fewer people are getting on-the-job coverage than before the employer mandate. Hard to believe, but only Washington could devise an employer mandate that reduces the likelihood you'll get insurance on your job.
And also what I heard from a lot of people on the ground is they're actually willing to pay the penalty and not enroll in, which is a whole different story, and it's become an extra tax for some of these patients. Look, as long as I wear a white coat, I'm not going to really get into the politics of whether it's good or not, but I can tell you that it's not helping the patients. It's not helping the doctors. There's a lot of conversations going on. and it's not healthy. Where can we get some more information? So we have Beating Obamacare 2014, Dr. Betsy McCaughey.
Come to BetsyMcCaughey.com, and that's a really unusual spelling, right? McCaughey, BetsyMcCaughey.com for all the information you need on Obamacare.
You got it. All right, I'm going to also post it on our blog. Betsy, thank you very much for being here. It's a pleasure. You've been an educator, and you really have put a lot of good information, and we'll post all of that on our blog.